7:25. Let's talk to Tony Stein, who is Chief Executive of Healthcare Management Solutions, whose care homes include the Patcham Nursing Home. Hello, Tony.
Morning.
Morning. Are we close to that point where we actually say care homes are in lockdown?
I think to a degree we're already reaching that point. We have already issued instructions to all of our homes, and it's common sense really to stop traffic through the homes when there's a infectious disease around. So we've basically closed our homes now to any effectively non-essential visits. Obviously family is exceptional, and people obviously when they get older they want to see their family. So we'll try and minimise those visits and hope that people are sensible. But
but that's the point. If that's not lockdown, then is it? If you're allowing family visits, I mean, who's to say that someone who's visiting from a family isn't carrying the virus? I mean, that's the risk, isn't it?
Well, absolutely. But the reality of life is you can't stop people from communicating and from moving around. Full stop.
You could stop all family visits, couldn't you?
You could, and if you think about a care home, though, and the way a care home works, you've got staff in there that have to go home, they have to take a break. We're working on contingency plans for if it gets really bad, and talking to staff about those who may be able to stay over in the homes. We're also talking about contingency plans for if, and this is sort of government advice, what happens if maybe a fifth or a quarter of the workforce is incapacitated, how do we manage then? But, care homes are a bit of a unique environment. Everybody tends to think about the NHS in a situation like this, but a care home is quite important here. We've got over 500,000 people at any one time in the country that are dependent on social care and living in social care settings. So they take quite a significant play a significant part in the whole process.
Sure. Tony, we wish you well. Thanks very much indeed. Appreciate you coming on this morning, and good luck to all your staff in coping with this, and to every other person who works in a care home. This is going to be a challenging time for all. I think it's 7:20.